Okay, now this is part two. We are still testing for cranial nerve 1, 2, 3, 4, and 6. We have stopped at the testing for the extraocular muscles, and that involves your 3, 4, and 6. Now we're going to discuss some basic reflexes. And let's see here. Okay, so these are three basic reflexes that we are going to talk about one by one. There are more, but we'll just limit it to that for now. Let's go first to your pupillary light reflex. Okay, so what happens with your pupillary light reflex? So, say you have your eye. Okay, that's your pupils. Now, if you shine a light, okay, let me draw a nice flashlight there. Okay, if you shine a light directly into the pupil, okay, the patient is looking straight, and then you cover one eye, and then you shine a flashlight here. Okay, don't poke the eye with a flashlight because that's going to be your corneal reflex. Now, cover one eye, shine the light directly at the pupil, directly at the eye. And what will you observe? Usually, the pupil constricts. Okay, this is even more dramatic if you do it in a dark room, because in a dark room, the pupils initially dilate. And then when you shine a light there, you could really see how it constricts. Okay, so that is the very basic pupillary light reflex in a nutshell. Okay, so we have discussed the reflex arc before. If you have missed that, you better go back and check and read or listen to the discussion on reflexes and the reflex arc. Now, as we've said before, your reflex arc needs a receptor, needs a sensory limb that includes your nerve and your sensory neuron, and then it synapses with your motor neuron, and that's your motor limb or efferent limb, and then you have your effector organ. Now, when we are dealing with these reflexes, you have to define these four. Okay, so when you are talking about the pupillary light reflex, what's your stimuli? Your stimuli is light. What's your receptor? Those are the cones and the rods. That's your retina. Okay, that's your retina. And what's your nerve? That's your optic nerve. And this is your cranial nerve 2 nuclei. And then it will synapse with your cranial nerve 3 and your cranial nerve 3 nerve, your oculomotor. And what's your effector organ? That's your, remember the circular and the radial pupillary fibers. Okay. So you're talking about the pupillary muscles. So if it contracts, it's your circular fibers. Okay. So this is the value of your pupillary light reflex, of reflexes in general. Okay. Number one, just by shining a light and seeing the response, what are you checking? Or if there's a normal response, so you shine a light, the pupils constrict. Normal pupillary light reflex. So you have checked, you have ascertained, you have made sure, or you have tested, you have proven that the retina is intact, You have proven that the optic nerve is intact. You have proven that the optic nuclei, cranial nerve 2 nuclei, that's in your brain, intact. Your cranial nerve 3, which is in your midbrain, is intact. Your cranial nerve 3 nerve is intact. And your pupillary muscles are intact. So how many structures did you check? 1, 2, 3, 4, 5, 6. 6 structures you have tested, and that is just one reflex. See? So if you know this, if you know how reflexes work, not only is it fascinating, but it also makes your job easier. You're not just doing these tests just because it's needed in your history and PE, but you are already troubleshooting. Okay? Now, that's your pupillary light reflex. Now let's go to the consensual light reflex. Okay, so now let's draw. That's how do you draw the eye, by the way. You don't put the pupil. Okay, there. Now, normally, that's why you cover the other eye. Basically, you could put something like this, okay, a piece of cardboard or just your hand, and then you shine the light here on one eye. Okay, once you have the normal pupillary light, you are expecting that this eye, the pupil in this eye would constrict because of the light, right? Now, normally, the other eye would also constrict. Okay, that's your consensual light reflex. Okay, the two of them will constrict, will respond even if you only shine the light on one eye. Okay, that's the reason why you cover this. Why? Because if you're shining the flashlight here, some of the light might also go to the other eye, and you're not actually testing the consensual light reflex. You're just testing the pupillary light reflex on the other eye. That's why you put a block here. Okay, so the normal response is this will constrict, you cover it. Okay, there's a cover, you shine a light here, this will constrict, and this will also constrict, even though there is no light here. That's your consensual light reflex. Do you know why? Remember the drawing or the picture that I showed you about the optic tract? You have your optic chiasm there and your optic radiation and whatever else. You see this? That's the link between the two eyes. Okay? And usually, our eyes are wired such that they cannot move independently like a chameleon. Our eyes move as one, both of them. Okay, that's how they are wired. Now, imagine if they're not wired like that, you're going to have a lot of headache with all that double vision. Okay, so that's your consensual light reflex. Okay, so if you cover this, shine a light here, you see constriction, you check the other side. There should also be constriction. Then you can say your consensual light reflex is intact. What are you testing? What are you testing? Well, the same structures as your pupillary light reflex, plus just add your optic tract or your optic chiasm, or the thing that links the two eyes. Interesting fact, if one eyeball becomes infected, there's a big chance the infection could go to the other eyeball. Why? Again, see this, your chiasm, where the optic nerve diverges or converges, no? Intersects with one another. So that's how it is. Now, so let's go to your problem solving. Problem solving. Let's say, okay, you cover this and then you shown a light. Okay, you shown a light there. What if this one constricts, but this one did not constrict? What is right and what is wrong? What's intact and what is not? Remember, you have a positive pupillary light reflex here, an intact light reflex here. So definitely your retina, your optic nerve, your cranial nerve 2 is okay. Your cranial nerve 3 is okay. Your pupillary muscles are okay, right? The only problem is you did not have consensual light reflex. So what's the problem there? A lot of things. Your optic nerve here might be damaged. Your optic, there's a problem with your optic chiasm, optic nerve there. Your cranial nerve 3 on this side might not be working. Your pupillary muscles or your retina might not be working. Okay? So that's the problem there. So how can you know which one here is the main problem? Okay? So you can check. You can check for visual acuity. You can have tests for your retina. You can check for your cranial nerve 3. You can do your own pupillary light reflex here. Is your pupillary muscle contracting? Is your eyelid elevating? If it's elevating, if your extraocular eyes are doing fine, then your cranial nerve 3 might be okay. If you shine this light and your pupils constrict or dilate in dark areas, your pupillary muscles are okay as well as your retina. Okay, so that's how you go about testing and using your knowledge of anatomy in diagnosing problems. Now we have gone from just knowing the facts to applying the facts. This is what makes neuroanatomy fascinating and terrifying. It is only terrifying if you only memorize the facts but do not understand it. That's where you're going to have a problem. And if you want to be a physical therapist or a doctor, you need to know how to analyze and not just store data. You're not a hard disk, you have to be a CPU. Okay? Now let's go to the third. Your corneal light or corneal reflex. So what is the corneal reflex? Your corneal reflex, okay, you're not worried about your, let's draw someone. Let's say this guy hasn't slept. Okay, now, what's your corneal reflex? You simply get a wisp of cotton, nothing sharp, just a wisp of cotton, and touch the cornea, okay? Not the eyelid, not the eyelash, the cornea. What's the cornea? Your eyeball, the outer eyeball. Your conjunctiva is the white. Okay, that would do. The cornea is the clear part, the center here. This one, that's the cornea. Okay, this one's the conjunctiva. But okay, you could put it in there also, but that's conjunctival reflex already. But anyway, once you touch the eyeball, the cornea, what usually happens? You blink, right? You blink. Sometimes it hasn't even touched. You already blink. You, okay? You suddenly put your fist in front of somebody's face. They would usually grimace and blink. Well, not really a corneal reflex, but it just goes to show that they can see your fist and their eyelids have the capacity to close. Now, let's go to your corneal reflex. So you touch the cornea. You're talking about touch or, well, pressure, a little bit of pain. Okay? That's your receptor there. What's your sensory? Your sensory is your cranial nerve 5, your trigeminal, ophthalmic, wrong spelling, wrong, division. Okay, remember the drawing. Okay, remember the drawing. So this part here, that is your ophthalmic division. This part here is your maxillary, and this part here is your mandibular. Your ear is not trigeminal, it's facial. Okay, so sensory is cranial nerve 5, ophthalmic division, cranial nerve 5 nuclei. And what closes your eyelid? I ask you. What closes your eyelid? Remember, a hook pulling your eyelid down, that is your cranial nerve 7. That's your motor, and your muscle there is the muscle that closes your eyelid. Now remember, test on your family member. Again, use a very thin wisp of cotton. I will not be responsible if you have blinded your father. Now, use that and see what happens. You will observe that when the patient blinks, both eyes blinks. Okay? Nobody, no normal person would blink only one. Okay? They won't. Usually both eyes blink. Okay? So again, you've also tested the other eye. The cranial nerve 7 on the other eye is also intact. But you haven't tested the cranial nerve 5 on the other eye. So what do? You touch the other cornea. Okay? So that's your corneal reflex. You are actually testing cranial nerve 5, sensory, and cranial nerve 7, motor. Okay? So those are the things that you need to remember. Oh, we actually jumped to 5 and 7, but that's it. That's okay. We'll discuss them thoroughly on our next session. So I do hope you learned something. We'll take it a little bit at a time. If you have problems, if you have questions, if you need something to be elucidated further, please let me know. Okay. Of course, one more thing before we leave. Again, we're going to talk about cranial nerve 3. It's your eyelid. Okay. Sometimes you see a person like that. One eye is drooping. So that's just by observation. You're already saying, or you're already theorizing that why is the eyelid one eyelid is drooping. There are only two possibilities, whether this eyelid is drooping or this eyelid cannot close. Okay? So, how do you do that? Or how do you test it? You tell the patient, close your eyes. Okay? You tell the patient, close your eyes, and let's say, what if the patient closes their eyes and do like this? They're able to close their eyes properly. So, what have you tested? You have tested that cranial nerve 7 on both eyelids are intact. So your cranial nerve 7 is okay. So meaning you really have a problem with your oculomotor. Another thing to do, what do? You tell them, open your eyes as wide as you can. And let's say they're able to do this. So what's the problem now? You can see that the cranial nerve 3 here is working, but the cranial nerve 3 on this side is quite weak. So you can say that cranial nerve 3 on this side is problematic. Cranial nerve 7 on both sides are okay. So that's how you use your knowledge of neuroanatomy to solve problems. Okay? You do not memorize everything just for the sake of memorization and storing data. You want to store the most important data to use it for analysis. And that's very, very important, analysis. Okay? So, I do hope you have learned something. Let's have some exercises after this. So, thank you.